Words of Wisdom. My name is Kim. Shed things on all light, love, and wisdom. And this week, I'm so excited. As an OT student, I look up to her. She's Dr. Emilia Dewi. She's an occupational therapist, but she's also certified in lymphedema therapy. She's a woman of all trades. She's a speaker, mentor, coach. She's a lymphatic specialist. You also do some myofascial release practitioner. So you kind of done everything, and you've been in the field for about 10 years. So I want to introduce you and welcome.
Thank you, Kim, for inviting me to be in your channel. This is exciting.
Yes. So
thank you.
Go into your story of, you've been in the field for like 10 years. So you've had all this experience and you're creating your own lane for OTs and like healthcare practitioners. So I guess dive into how you got into your passion with everything.
Yes. So with lymphedema, actually was introduced by my clinical instructor when I was in graduate school. So for I think my second field work, I was at USC hospital, and my CI was a lymphedema therapist who provide care in acute care as well as an outpatient. So I get to see a lot of patient with breast cancer, a patient with head and neck cancer. And what fascinated me about lymphedema was lymphedema therapy, because you see patient with stroke and you see how long of a journey it is. And you see, you do a treatment session and it may or may not make a difference at that point. However, with lymphedema therapy, when you do it like at the right time in their, like stage of disease, it works so well. And the impacts that patient have in their life in that point is amazing. So I think that's what really got into me, because I was like, well, I've seen all this stroke rehabilitation and it's really important and valuable, but with lymphedema, it is effective. And there is like sort of a science to it. So as a student, that was something that really appealing to me, because, you've heard it from your professors, right? It all depends, right? The answer is always, it depends. And now I can tell you 10 years into it, the answer is kind of, it depends.
Yeah.
But with lymphedema therapy, because, there's a specific way to treat, even though there's a lot of it depends, but there's also a lot of structure. So that was something that was really appealing to me as a student who was still learning everything. And there's a lot of science with the lymphedema and lymphatic system. So anyway, that's kind of my story. But then when I moved to Houston, I actually didn't think that I was going to do lymphedema therapy, because I joined a clinic that specialized in neurorehabilitation. But then 1 year into my career there, my hospital decided to open a lymphedema program. So I became one of the first 2 OTs to get certified, and the rest is history. Because the more you learn about lymphedema and the lymphatic system, the more, because we're barely touching the surface of the knowledge that we're going to get in the next coming years. So it is just exciting. Every single time I go to a conference, I learn something new, and I'm like, wow, this is why I become an OT, right? Because there is just continual learning and continual information that you can use to help your patients as well as yourself, because, we're going to be there someday. Mm-hmm. Unfortunately.
Right. It's like we're going to eventually be in that position. But I think with lymphedema, it's the things that we can't see that sometimes people are like, does this work? But you said it's a whole science and it goes deeper. And I feel like as we shift forward, even me as a student, I'm looking to you, because it's like you're kind of ahead in the game in the way of like, there's more ways that we can help people, that it's not the physical aspect. There's a lot going on that we can't see, which is that whole lymphatic system, basically.
Yes, because the lymphatic system is basically a part of your immune system and your filtration system. So if you think about just let's use your toilet for a second, right? If you have a toilet and the filter doesn't work and the pipe is clogged, what's going to happen? Your toilet's going to be dysfunctional and you cannot use it. So let's apply that to our body and your lymphatic system, which runs throughout your body. Like they have lymphatic vessels, lymphatic nodes. If one part is clogged up, and if that really has to do with your immune system and your filtration system, can you think about, any disease that can be caused by lymphatic system? Autoimmune disease has been shown to kind of have some correlation with lymphatic disease. Mm-hmm. And I've been talking about this a lot too, but your brain is also drained by the lymphatic system. And when your brain is not draining properly, it can leave certain proteins left in the brain. And I don't know if you know this, but there now new research about the amyloid protein in the brain, and like when you have an exceeded amount of that, it is correlated to Parkinson's and Alzheimer's.
That's something I've lightly heard of, but I feel like you're the resource to really get that out. And it's like, I feel like as time goes on, we're going to learn more about that too, that correlation.
Yes, because, I think another thing that I notice as as I'm serving my patients who are older adults with different diseases, a lot of them actually have sleep issues. And if you think about how sleep is when your brain actually drains. So when you don't sleep, your brain doesn't drain as much, right? I mean, there's no research about that yet. I think in the future, they're probably going to be more. Mm-hmm. But your sleep quality and your cognitive status, I mean, they are go hand in hand. So as a student, I mean, one thing that I can tell you guys is that you need to sleep.
Yeah.
Because you think that you can sleep when you pass your board or something, but what you do right now in your 20s, you're in your 20s, right?
Yeah, 25, yep.
There you go. What you do right now is going to set up your path for when you are in your 60s and 70s. So, I mean, this is kind of like besides the point, but I was talking about it with my friend in our podcast. But stress level, actually, there's a study by MD Anderson that a lot of times stress is associated with your first cancer onset.
Wow. It's totally correlated. Totally correlated.
Yeah. I mean, and stress has been shown to be linked with many chronic diseases. So I was really stressed out last week, and I was like, no, I don't want to be stressed out because I don't want to have all these chronic diseases.
Right. It just it totally leads to other areas. And that's what I want people to realize, is that you really have to get your sleep. And that's why I've been talking about sleep personally, because I totally respect it, because what it relates to, So kind of going into that lane of what advice could you give people about being certified in lymphedema therapy and kind of creating your own lane? I feel like you have so many avenues. You have your podcast, you have your content on your website, you have your Instagram. It's kind of like you can share everything from all of your gifts that you have and all the resources and information that you have as an individual.
Right. I think right now, like I said, there are so many resources for students. So if you're interested in the lymphatic system, I mean, I'm trying to create more content in the area, but also there is the National Lymphedema Network. They've been around since, I believe, 1998. And they are the one that has the conferences every single year. They have a lot of free training, sometimes available. And then right now, a lot of the, the vendors, the people who creates products for people with lymphedema, they produce a lot of content that are free online because of COVID, right? So all you have to do is just attend a Zoom webinar and you can learn more about head and neck lymphedema. You can learn more about breast edema. So there's just so many things out there. I think I put a blog post on that, but I probably need to update it because there's just so many more courses that's available. So that is a way for you to get your feet wet and just kind of start learning about it, because lymphedema certification is quite lengthy. It's 135 hours and it's over $3,000. And usually it's 10 days, right? Because that 90 hours is live and 45 hours online. So you have to spend 10 days out of your work week to actually go and take a course. So I feel like unless you know for sure that that's the lane that you want to be in, you probably shouldn't do it because it's a huge investment. And with lymphedema, unfortunately, not unfortunately, I guess, there are so many different types, I guess, of lymphedema that you'll see. There's lymphedema in the legs, there's lymphedema in the neck, there's lymphedema in the arms because of different causes. And there's also lymphedema that is associated with venous condition that can look like they have a lot of ulcer wound. So, some OTs who specialize in this area actually also certify in wound care. That is not my cup of tea. I don't like wound care, but some people loves it. I have a coworker and he loves wound care and lymphedema. So wow, that's his jam. So, but I mean, when you work for an employer and you're said, oh, okay, I'm lymphedema certified, sometimes you don't have an option on what kind of lymphedema you'll treat.
Right.
Because, for me, I see patients with leg lymphedema. I see patients with some level of wound. So they will need to be able to address their own wound care, and we can help a little bit, but I'm not going to be the expert in wound care.
Yeah.
So I think, like ideally you would go work for an institution that will pay for your certification. That would be ideal, because with that much of manual therapy, I mean, OT school is great about really setting up the foundation of you to be an OT as a generalist. I mean, the foundation that I have from that, the mindset, I mean, I carry it throughout my career. But the manual stuff, I don't get anything when I was in school, like very minimal manual stuff. And the only reason why I got it was because one of my instructor is NeuroFRA certified. So we get a lot of like the motor control type of thing. But other than that, it's very minimal. So if you don't use it right away, I feel like you're going to lose some of that skill.
Right. You have to kind of keep, it's like what is it called? It's a skill basically that's repetitious and
Yes.
memory, muscle memory with all that. So that's something that we have to continue to learn. And I feel like we can, as students, we can even look at resources in our free time and kind of get our hands on work when because they don't really teach that in school sometimes, and go deep in that area, like you said.
Yeah. Yep, absolutely. Because I mean, this is my soapbox, but I know that OT is trying to step away from medical model, but at the same time, a lot of us are still working within the scope of the medical model. So, I mean, where are we going to get that education to students? Because if you're going to a hospital now as an OT student and you have to see somebody with lots of lines who just had surgery and they have a lot of pain, it is very overwhelming. It is.
Right. Yeah.
So, like you have to get it somewhere, and sometimes 12 weeks of field work doesn't really cut it. So
right, they jam pack it all in, but I guess that's what we're leading into right now is this hands-on, this technique that you have, this lymphedema. What is it? The sinus drainage technique. That's what I got from her channel, from her Instagram, and I love and I want to share with all of you. So if you could kind of bring us through that, or
yeah, sure.
describe that, I think it's awesome.
Well, it's basically actually a head and neck lymphatic drainage, right?
Mm-hmm.
But I use it for sinus drainage, because the funny story was that one of the rep who rep for a pneumatic device, which is a pump for your lymphatic system, they have one for the head and neck. And then the guy was saying that he's like, I use it whenever I have sinus drainage. And I was like, oh, that makes so much sense. I mean, I learned this technique to do on my patient who has lymphedema because of cancer. But I was like, I have lymphatic system. I can use it on myself. Right. So basically what you want to do is a very light touch. So you're going to just do enough pressure, a semicircle pressure. Yep, just like that, just enough to stretch the skin. So it's ideally done directly on your skin.
Okay.
And you're going to start with the collarbone right here. So I don't know if you can see it. And you're going to just make a semicircle. Perfect. You don't want to do a circle, because circle, there's no direction. You want to direct the lymphatic fluid. So it's going to be a semicircle. As you notice, I rest for a second, and then you do the other side.
Okay. Semicircle.
Probably need it this morning. Semicircle. Yep.
This will set me up good for the day, huh? This will set me up good for the day.
I know. Especially in the morning when you wake up with the heater, and then you have like a little drainage, and then you're like, hopefully this is not COVID.
I know, seriously, break it all up.
And then you're going to do your neck right here. There are more steps to this, but I just make it simpler for this part.
Yeah, of course.
So you're kind of pushing it back toward the ear right here.
Okay.
And then you do the other side.
And kind of coming,
so you're putting it back. The other way. Back.
Okay.
Because there's like a lymphatic pathway that goes right here.
Okay. So back. Wow.
Mm-hmm. Back and down. And then you're going to push this one right here. So with this one, you're going to use this part of your hand.
Mm-hmm.
It's a web space. And then you're kind of milking.
That actually feels nice.
Because we have a lot of tightness too through here. So this is a good stretch too. Because I mean, if you just even look up, I mean, from all the things that we do down here, so this part becomes pretty tight.
Right.
And then we're going to go up to your face, and you can do your cheeks first to warm up. Don't make wrinkle front. Always make wrinkle out.
I'm squishing my face.
Yes, I always teach my patient, you don't want wrinkles. And then finally, you can do the nose.
Nose.
And this is like, like the nose and right under your eye.
Yeah. Wow. And that's kind of the upper half that'll kind of set you up, right?
Mm-hmm. And then if, like sometimes right here, I don't know if you know this, but you can get sinus pressure around your, I guess, your temple area. So I would just add one more right here just to get out of the way. Because sometimes when you have sinus pressure, it will go up and then it will cause you to have a headache.
Right, which I've felt before, but like the details of this and what I'm learning about, that's what's probably going on beneath the surface. Wow.
Yes.
So
I feel relaxed.
Yeah, no, I already feel so much better. So I encourage you all to do that because it makes a big difference that you'll notice after, even though you can't see it physically, but the way you feel is pretty important. So I love that one.
The only one I would caution, if you have sinus infection, don't do that.
Okay, don't do
it before.
That. Okay, don't do that if you have a sinus infection. But otherwise, yeah, it could definitely help you out as the cold season comes through too.
Yes. And the reason why for sinus infection is because you don't want to spread the infection. So that is a general rule for any manual tick drainage. If somebody has an infection in the area, we don't want to do it until they've been on antibiotics for a couple of days.
Right. Well, there we go. Wow. I'm going to sit and feel that, of course. But I guess going into the end of this, what are you kind of grateful for and what are you looking forward to? I know the year's coming to a close. It's been a long year for everybody. And I think I'd like to really know what you're grateful for this year,
I think this year, during COVID, that's when actually I started to really get connected on Instagram, because before that I only post pictures of food. So I started my lymph therapist Instagram in April, and since then I have connected with so many OTs throughout United States and even some in other part of the world, and that just kind of shows me that the world has become smaller and we get to choose if we're going to make the best of it or lament the old days. But I think there are some really beautiful, wonderful ways that Instagram has to connect all of us. And then also grateful that I still have my health and my mom also still healthy and she hasn't been sick yet ever since all the pandemic started. So I'm thankful for that. I'm thankful for all the friends and support that I've gotten through this year. Because you cannot, and that's one thing that you learn through COVID is that you are not meant to do anything alone. And, isolation can cause people to have depression, to have stress. So make sure that you stay connected with your friends. I'm thankful that I have friends that I've been connecting with throughout this journey, and it cannot do it by myself.
Yeah, that's awesome. I feel like family is one thing that you said your mother too, that she's healthy. I know just something as simple as that. It's beautiful that, you've gone through the year and you still have your mother and your family to kind of support you. And even people, you said the world is smaller than we think it is,
Right. I would not have connect with you if it's not for the Instagram, right?
Right. Yeah, exactly how we connected and how we, share each other's content. So I think it's amazing. So I want to encourage everyone to go to your Instagram page. It's the_lymph_therapist, right? Is that the
That is correct. Yep.
And you also have your website, the Lymph Therapist. Yep, the lymphedema.com, where you have all of your content, your blogs, everything, and your resources to connect with you, because you also are a mentor, a coach, and a speaker. So that's amazing. I'll put all of that in the description below so you guys can get more of Dr. Emilia Dewi. But I want to thank you so much for joining me on your vacation and taking your time out of your morning. Appreciate it.
Yes, thank you. Thank you for inviting me.